I am Jennifer Stone. I am living in the Los Angeles area. I was diagnosed in 2011, and I actually started in a clinical trial right from diagnosis. So I did that for a little while until I had some side effect issues with one of the medications. I was looking for support group help, kind of understanding what I was going through. And the LA area is so large that our main support group was pretty far away. So I tried to do some organizing in the valley a little bit, a little closer to home. It's been hit and miss. And I just kind of try and stay active in the community with information and learning new things. And my number one goal was really to kind of stay off of the pump, which I have successfully been able to do for 8.5 years. I was having some difficulty breathing, some chest pains, just challenges with normal activities during my day. I work at a school, so I'm constantly on my feet. I went to the doctor and they kind of brushed me off and told me I was overweight, I needed to exercise. I'm sure everyone has heard that story before. They did a chest x-ray and I never heard anything about it after that. And I was really lucky that the doctor that told me I was overweight happened to leave my medical group, and I got assigned a different doctor who did take a look at my chest x-ray and said, something is a little amiss here. I'm going to send you for some further tests. And from that point, it was really quick. Like I would say I was in a cath lab in like 2 or 3 months, had a doctor, had a diagnosis, was on medication pretty quick. Once I got a doctor that didn't just brush me off, I was on a good path. I actually have a family member that was involved in a clinical trial, not for PH, but for another medical condition many, many years ago, which probably saved his life. So I had a really good understanding of clinical trials and their benefits. My doctor is pretty big on research. Pretty much not every visit, but almost every visit. If I wasn't feeling great, it was, I have this clinical trial that we should talk about. She's really big into looking at different options. And it was presented to me as I was brand newly diagnosed. I'd never been on any medication. And this particular study was for patients just like that who had not been on anything else. And it was probably pretty hard to find. I guess I wanted to benefit science. It was not a study where I was going to get a placebo. I was guaranteed to get some sort of combination of medication. And that honestly, my doctor kind of said, this is probably what I would start you on anyway. So I liked the fact that I was really well monitored. I had appointments every 4 weeks. I was in the office. They did tons and tons of tests and spent a ton of time with me. Being that I was really new to the illness, I thought there were a lot of benefits. So I thought it would be a good idea to just give it a go. And, they kind of let me know if it didn't work out, I withdraw and I go the regular way. But thought it was a good option. The first trial I was in was about 24 weeks. So that covered the first 6 months of my post-diagnosis. And then I did my own thing with regular medications we played around with a little bit. I was blessed that my health was pretty stable for years and years and years and years. About 9 months ago, I started to notice a decline in my breathing. I noticed a little more challenge with daily activities that were fine 2 years ago were all of a sudden not as fine as they were. And I was getting nervous because I knew I'm on basically one medication for each pathway. So I knew that I was really limited as to what my options were going to be. And I was looking at ending up on the pump, which was, again, not my ideal situation. My doctor talked to me and said, we have this trial for the new Tyvaso delivery device. It's way more convenient than the device that you're currently using. And the other benefit was the way that the dosing works. They could increase the strength of what I was getting if I continued through the trial. They have these little capsules and they are different dosings in them. So you can alter those with your doctor. Again, I was doing everything I could to stay off the pump. So I'm like, hey, I'll give it a try. It can't hurt. So I started that about a month ago, maybe a little over 5-6 weeks. The study itself is 3 weeks, so I'm technically done. I'm in what they call the extension phase. I go in every 4 weeks and I get a new batch of medication and devices. And really my goal is that I'm kind of back to where I was before I started feeling a little icky with some of my normal activities. And I'm hoping to just postpone anything else, anything further for as long as I can. I mean, I was kind of hoping for a year or two if I can, but as long as I can. So I will say that I feel, and my walk kind of shows that I'm basically back to where I was before I started feeling bad again. So right now, it looks like everything is doing exactly what it's supposed to be doing. So I'm pretty happy with it. Obviously, it's a very personal decision. You want to talk with your caregivers, family, your doctors as to what their recommendations are. I think trials are amazing because how else are we going to make progress in fighting this illness if we don't help each other and learn and be a little bit of guinea pigs? But I think that's how we make progress with drugs in our country. So somebody's got to try it. So if you're able to, I think it's amazing. I know there are people that struggle with the costs of our medications, and this is a fabulous way of also mitigating that. Since I started this trial, I'm not paying for Tyvaso. It's coming through the trial. Obviously, my insurance will still cover it, but it's nice to know that it's coming. I have a really positive outlook. I think that people are doing great things in science every single day. So do what you can. There are so many more medications than there were years ago. Try anything, try them all. But yeah, I mean, trials are so beneficial. So if somebody's willing to give it a shot, talk to your doctor. And also, I know that not all medical centers are participants in studies, but if you're able to travel to a bigger center that does have studies, look online. As you're searching for clinical trials, the website phaware also has a clinical trial searching, matching engine that you can use. Definitely give that a shot and see if you can find something in your area that works for you. They're worth it. I am Jennifer Stone, and I am aware that I am rare.